It is a huge honor for me today. I'm in Singapore with my friend Dr. Yeo Kok Beng.
That's right.
And you're graduating dental school in 2000.
That's right.
And you're sitting next to this bald, beautiful man here. Is Bernard Phua, Phua, Phua. And what I'm so romantically involved with Bernard is you are the first graduating class in Singapore. In Singapore, they call it an oral health therapist. The United States would call it a dental hygienist. But you went to, you started school in 2003, and you graduated in 2006, and a graduating class of 25.
Around there is about...
And congratulations for being on the first graduating class of a great sovereign professional of dental hygiene, because it's sad when you go to a country and all the dentists are so busy drilling and filling and extracting teeth and placing implants that nobody is there preventing disease. And it used to be that way in the United States, where everyone was a dentist. And there was a man by the name of Bob Barker who in the 50s was going around to all these little countryside towns in America saying, you need to have hygienists. And they would say, I'm so busy pulling everyone's teeth, making dentures, I don't have time for this hygienist stuff. So what is it like being in the first graduating class? I mean, what percent of Singaporeans understand the importance of getting their teeth cleaned by you every couple times a year, so they don't end up having this man pulling their teeth? What's that like?
Okay, generally, Singaporeans are very health conscious. So when you're talking about prophylaxis, maintaining their oral hygiene, they are pretty on time. Every 6 months, they will actually call us and make an appointment. But because this profession is still very new in Singapore, we have old patients who are actually reluctant to see us because they are so used to seeing dentists. So most of the time, I would say maybe 60% of the time, they might request to see the dentist instead, because they may have been seeing the doctor for like maybe 10, 20 years, and suddenly this new young guy comes along. Some people they are reluctant. They are more used to seeing the doctor. So this profession, like I said, is still very new in Singapore. It's maybe about 10 years old. So I guess in every profession, it takes time for it to actually run well. So yeah.
And it would also be hard to build up your profession because in Singapore, you're not allowed to advertise.
Yes.
So there's 5.5 million people in Singapore, and you're not allowed to go advertise, hey, I'm an oral health therapist, and come in. You can't. So how do you educate Singapore people? Just one at a time?
Yes, basically that, one at a time. And basically the dentist has to come forward to tell the patients that we as therapists are here to do the simple stuff, basically cleaning, checkups, x-rays, and then we'll refer the relevant cases to the doctors. So the doctors play a very important part in this as well.
And what's also hard for what you do is in United States, Canada, Australia, England, the insurance would be paying for the cleaning 100%. But here in Singapore, you have to get the person to pay for it out of pocket. So that's a much greater challenge. How is that challenge? How much do you charge for a cleaning, I guess?
Typical rates, we go about between 60 to 80.
60 to 80 Singaporean dollars.
Yeah.
And right now a dollar US is about $1.50.
1.4.
1.4.
Yeah.
And you're charging 60 to 80. Yeah. So I can, yeah. So congratulations. That's I didn't go to school to become a dentist to pull someone's teeth and give them denture. I wanted to prevent disease, not treat disease. So you're at the forefront of prevention, whereas I feel as dentists are at the forefront of drilling, filling, extracting. So that's just amazing. And you had the foresight. You're a pioneer in your own right. You're a young dentist.
I'm not that young, but young enough.
Well, I'm 53. How old are you?
I'm 40.
You're 40.
Yeah.
Asians don't age. I've already figured that out coming to this country. No, you go to England and Ireland. I mean, people look their age.
Okay.
But you come to Asia, nobody looks their age.
I guess so. I guess it's the food.
It's the food.
Yeah.
And I need to switch to an Asian diet then. But you're a real pioneer in so many ways. I mean,
Thank you.
Congratulations on hiring one of the first hygienists to graduate in your country. So what is it like? So you have 6 offices.
I do.
So what's that like in Singapore?
So it's a challenge, but at the same time, it's very fulfilling because I get to run my practices and the way I want it to be. And but it's challenging because in Singapore, there's always, like you mentioned earlier, we can't advertise. So there's always, we had to work really hard trying to do our own word of mouth, branding and marketing and stuff like that, and build our patient base. And so the challenge is ongoing and trying to educate the patient same time by asking our hygienists to help us do the prevention so that we can reserve our time to help fix all the diseases to restore the patients who have broken dentition and stuff like that. So yeah, it's ongoing.
So when the Minister of Health says you can't advertise, what exactly can you not do? Because there's, they always say there's ways around every law.
The Ministry of Health is pretty strict.
What can you not do?
You can't advertise and say you provide this services and show before and after. You can't promise certain kind of results, the potential results. You can't show them that if you do whitening, you get white teeth. You can show before and after. You can't guarantee them that you get certain kind of results by doing certain procedures. So there are a lot of restrictions when it comes to advertising. You can't send out flyers to advertise. You can't display photos on your website. There are a lot of restrictions. So basically, it's more to protect the patients. They don't want the professionals to overpromise and under-deliver. So it's more, the Ministry of Health protects the patients, protects the public.
But Coca-Cola, Pepsi, McDonald's, and KFC, they can advertise all day long.
Yes, that's
that McDonald's that sells quality food.
So that's the thing. So it's always very interesting because even for simple things like teeth whitening, we can't advertise, we can't educate the public through the normal social media channels, but you have those beauty salons doing teeth whitening in their salons, in their spas, and they are not bound by any regulations. There's no control. They do not have any dentist to check. So it's always a little bit of conflict. So we are trying to work with the ministry. Yeah, it's a long road ahead. But
So if you can't do those types of advertisings, how do you compensate for that? Do you have to have like better locations, or do you have more visible location, or what are the workarounds?
it's always challenging because you can't always have the better locations because of cost. The better locations will cost a lot more, and there's always because Singapore is a small country, and size you can't get big offices like in the States, because every square foot costs a lot. Yeah, so we compensate by trying to build up our practice by word of mouth and through whatever little forms of marketing we can do within the clinic, internal, and as much as possible, just try to make our website a little bit more attractive and try to reach out to more people through the social media channels within the regulations of the ministry, of course.
So here, website SEO, search engine optimization, Google AdWords, Facebook ads, that would be...
That's the norm right now. Yeah. For most clinics, they are all jumping on the social media and internet bandwagon and trying to utilize all these SEOs and stuff like that. So
I find it amazing that the city's only 50 kilometers by 25 kilometers, so
yes,
it only takes 45 minutes to drive across the whole country.
That's right.
With 5.5 million people.
Yeah.
It's just a beautiful country.
Thank you.
So why do you have 6 offices? What's all that about?
Okay.
Do you have a dentist working at each office?
I have a few dentists working in each office.
So you have 2 dentists?
2 to 4 dentists.
At each office?
Yes,
So
that's
you're
right.
quite the dental magnet to be 40.
Yeah,
You're 40 years old, you
40
said?
years old, yes.
40 years old, 6 offices. How many dentists work for you?
I have 12.
Now, are these partners or employees?
I have one more partner, and the rest are associates, employees.
Employees.
Yeah.
So you were a partner with one.
Yes.
Is that must be your wife?
No, my wife. I try not to mix work and family. So my wife is an orthodontist. So
Really?
yes. So
And she's not
but
she doesn't
she's
work
not-
for you?
No. I mean, she works for me, but she's not a partner.
Yeah.
Yes, I don't want her to be a partner because I don't want to bring work back home.
Wow. So your wife is your employee,
Yeah, my wife's my employee,
and
I have my partner is just a buddy or my classmate whom I graduated with. So we started at first, and we just build on from there.
was your wife your classmate in dental school
No,
too?
she's not. She's 1 year junior.
1
1 year
year-
younger than me. Yeah.
So you didn't meet her in dental school?
I met her in dental school. She was 1 year younger than me. So yeah, from then.
In the States, they say 30% of the women married a dentist in the class.
Uh-huh.
And in Singapore, had dinner with a couple of women dentists. They said it was 20% in Singapore.
Yeah.
Is that about what you?
That's about right. That's about right.
That's about right.
Yeah.
1 in 5.
1 in 5.
Well played. That's my only regret in dental school is that I didn't marry one of my classmates. That was that would have been such a wiser move. But I can't say that out loud because my son Ryan is filming the podcast, and I don't want him to hear those are my thoughts about his mother.
Yeah.
So you also got into placing implants,
That's right.
and is that a fast-growing thing, or what's the implant market like in Singapore?
Wow. I don't have exact figures, but it's growing. It's fast growing, and
I mean,
it's pretty good.
is it mostly elder people that lost their teeth from gum disease? Is it mostly one tooth replacement from younger people who just lost one tooth? Or what is a typical market?
for the past 10 years or so, the majority of the cases are always the elderly patients who lost quite a number of teeth, and we just try to replace them, do implant-supported dentures, and try and do some implant-supported bridges and stuff like that. Plenty of implants to sink. But now we are seeing more and more single-tooth implants coming in from the younger patients who lost their teeth through accidents, sports, or even just from one isolated case of
Sports.
infection.
I thought the number one sport in Singapore is badminton and table tennis. How do you lose a tooth from table tennis?
A lot of them lost it during sports when in your schooling days when you're younger.
It's Indonesia who's number one in badminton, right?
Indonesia's
badminton.
They are very strong in badminton.
And Singapore is very strong in table tennis.
Yes, in Southeast Asia we are strong in table tennis. Yeah.
But no one ever lost a tooth from table tennis.
No.
Okay.
Yeah.
So basically, what you're saying, the older people lost their teeth from gum disease.
Yes.
And the younger people,
Usually it's one single tooth. Yeah.
Single tooth. And I know you're a big Megagen fan.
I am.
What percent of the implants you place are Megagen?
90.
90. And why is that?
Easy to use. Great support from the sales staff, and I have great results with Megagen. So after a while, when the system is easy to use, you have great results, you just stick to it. And there's always continuing education, and I always attend their symposiums and their conferences and their workshops overseas. So I find that there's continuity, there's support. So it's good. Yeah.
Well, when you say support, Ryan, the one thing I'm always seeing is that when people buy implants on price and they buy them the lowest cost and they don't have a human friend element, those types of people never seem to place very many implants. But whenever I see someone placing 100 implants a year, it seems like the most valuable thing to them is the support.
Yes.
They know a human, a friend.
That's right.
In the implant company. And I think that's just the final straw that just gets it done. Because all those people who have a friend seem to be placing 100 a year.
Yes.
And everybody that doesn't have that friend, for some reason, it just never reaches critical mass. And they just don't seem to be big placers of implants.
Good points. Yeah, that's right.
You'd agree with that?
That's what I noticed among my friends as well. Those who place a lot of implants, usually they have a great support of someone in the dental implant company who provides that friendship and that kind of clinical and non-clinical support. because you need someone to help you link up with all the people to help you look at the case and to link up with other people around the world, other surgeons and other implant dentists around the world to help you improve. You want to improve.
Now, you're not old enough to remember the dot-com bubble, but between 93 and 2000.
Yes.
Do you remember that?
Yeah, yes, I do.
Because it was funny because about a dozen dental companies were going public that were all going to sell you supplies over the internet.
Oh.
And every single one of them went under. And the reason it went under is I called it, I went with Dental Town in 98. I went with the community where people could talk to each other and online see. I didn't go for the selling supplies because I had my own dental office.
Oh.
And I thought, well, that lady who comes in once a week, I mean, that's my only link to the outside world.
Yes.
And I'm not going to trade her in for 10% off gauze. I mean, I was always like, well, what file is my endodontist buddy Brad Gettleman using?
Yes,
or
that's right.
what is my buddy Tim Taylor? What is he cementing his crown with?
That's
or
right.
what is Tom Mattard using? And that link, that human,
Yes.
I called it. I said, well, I can't go without mine. And it turned out no one else wanted to go without theirs because nobody's buying their supplies online and everybody's still buying for a human. And that's the point I'm trying to make on this podcast is that the dentists who buy from a local, like Tarun Agarwal, my friend, he buys high-cost Noble Biocare, and he says, I don't care about the cost. It's my buddy. He says, I place 1,000 a year. I need my buddy, and he doesn't really care what his buddy sells. Yeah. So you're saying support's big.
Yep.
So your wife is an orthodontist. What's the ortho market like in Singapore? Is it more just kids only? Is it just for girls? Is it adults?
Right now, there's, speaking on behalf, there's still plenty of children, plenty of kids. Of course, we are seeing adult patients, but right now, what we notice is the adult patients are shifting from ceramic braces to Invisalign. So she's still seeing a lot of kids. And in Singapore, I guess because there are less, the number of, the size of the families are getting smaller, as in every married couple is having fewer kids because it's just the Asian trend. So when they have fewer kids, they can devote more resources and provide and make sure that all their kids have braces. Because I think more parents are aware in Singapore right now. So they are willing to spend on their kids and willing to improve the smile, correct the alignment, stuff like that. So we see a lot of kids. Whereas adults, there was a time maybe 5 to 6 years ago or maybe 7 years ago when there were a lot of adult patients, but slowly we see that they shift to Invisalign because Invisalign was coming on very strong and they're having pretty good results and their marketing is really, really strong and branding is really strong. So a lot of adult patients are switching to Invisalign. So we're seeing less adult patients now.
So is your wife do mostly fixed brackets and braces on children?
Fixed, yeah, on children.
And then mostly removable clear aligners like Invisalign on adults?
Yes, that's right.
And the kids seem to like the ortho because they still like the colorful rubber bands or, the fixed braces they don't care about?
No, I wouldn't say that, but it's just that because Invisalign is a lot more expensive in Singapore. I don't know how much they charge in the US, but it's always easily double or close to double the price of fixed braces for kids. So most parents, while they're willing to spend, they are unwilling to splurge.
But let's take a 12-year-old girl in Singapore.
That's right.
Would she rather have fixed braces with different color rubber bands, or would she rather have removable Invisalign if everything costs the same?
I think most 12-year-old girls will go for Invisalign.
Most 12-year-old girls.
If everything is the same, cost is the same, so-called the speed or duration of treatment is the same, I'm sure they'll go for the Invisalign, the clear aligners. That's
just so they could take it out.
It's not as while the colorful rubber bands are attractive in certain way, but a lot of them do not like the metal part or do not like the fact that they have something that's fixed on the teeth. So we do see a lot of kids asking about Invisalign, but when the cost comes in, there's always a setback. There's always a deterring factor. Yeah.
So what do you think is going on in your sauce to where the average dentist has probably 25% work somewhere else. The other 75% might have their own office. How did you get to 6? What made you get to 6 offices? Do you think you're just born more ambitious, or
No, it's not.
what do you think is going on in your sauce that made you? What's
No.
that all about?
I think it's just a case of not being able to say no. Because what happens is when I first started my first office with my partner, and then we have people asking to join us because we seem to be pretty happy doing what we are doing, and there was space available, there are patients to be seen, so we say, okay, come join us. So after that, more people ask us, hey, can we join you? But we have not enough chairs, not enough space for them, so we say, okay, but we have not enough chairs, so we set up another practice, another office to accommodate you, because you like what we do, you like what the way we do things. So started from there, and I still can't say no, so I'm still expanding because people are coming on board, and well, we just say, okay, if you like what we do, join us. Welcome aboard.
So you have 6 offices now.
Yes.
And do you have hygienists or oral health therapists in all the
I
offices?
try to recruit, but like I said, I mentioned earlier, it's quite challenging. Like Bernard is the guy who's doing really well. Maybe because it's from a pioneer batch, so he's really experienced and he's able to convince the patients, and we try to educate the patients. But a lot of other hygienists that I employed, I recruited, they do not have the patient base that Bernard has. So it's always challenging, and we spend a lot of time trying to educate the patients. At the same time, we try to encourage our hygienists, but some of them do get a little bit disappointed or dejected or demoralized if they don't see a lot of cases. So there has to be a balance strike somewhere. So yeah, we're still trying to recruit and boost up our hygienist count. It's a challenge. We do have hygienists join us, but usually after a year or two, they find that okay, they don't hit their target number of patients a day. They feel they are not really being utilized properly, so they say, okay, let's try somewhere else. So they move on, and some do quit the profession totally.
And are they oral therapists? Are they in the dental schools?
Yes.
Are those you're a dentist? Your wife is an orthodontist. You're oral health therapist. You're a man. Are the schools like 50-50 boys, girls, or
around 50-50? Yeah, 50-50 for the local school.
For dental school and the oral health therapists.
We started with more females, but nowadays it's about 50-50.
It's about 50-50 men, women.
Yes.
And what is the state of, I know Singapore has community water fluoridation. What is the state of composite versus amalgam? I mean, if in Singapore, if 100 MOD fillings were placed, what percent would be composite? What percent would be silver fillings?
Well, if you're looking at the current trend, most of them will be, I would say over 90% will be composite. In fact, the amalgams are all placed in the past 2 decades. Right now, all the new cases that most clinics, not just our clinics, but most clinics, they would replace with composites. In fact, we are shifting to CAD/CAM, CEREC stuff. A lot of clinics are moving towards CAD/CAM, CEREC. They're moving away from composites. We're trying to move away from composites, trying to move to CEREC. And the amalgams are totally outdated. If you go and visit 100 clinics, 99 clinics will not even offer amalgam as an option. That's the trend. Right.
And is that a Singapore trend, or go through the countries of Southeast Asia? Would that be the
just
same?
a Singapore trend? I can't speak for Southeast Asia like Malaysia and Indonesia, but in Singapore, all my peers, they
Or
don't
amalgam free.
They don't put in any more amalgams. No more amalgams for
And so
our
you have
peers.
6 clinics. What percent of them have a CEREC machine?
2 of my clinics, so it's the 2 out of 6 have CEREC. We have Planmeca. We brought up Planmeca reminiscence.
Oh, okay. I'm sorry. I didn't
mean
mean CEREC. I meant CAD.
CAD/CAM. Yes, 2 out of 6 have a CAD/CAM.
And it's Planmeca.
Planmeca.
And talk about that decision. There's Planmeca,
And the
which
CEREC.
owns the Planmeca out of Helsinki, Finland,
Yes.
which owns the E4D CAD/CAM
That's
out
right.
of Dallas,
Yes,
Texas.
yes.
And then there's the German Sorona system. What
Yes.
made you go with the Plan Mecca
The friend.
E40.
The human friend. The friend.
There you go.
There you go. Provide great support, helps me solve all my problems, comes down to my office when I do not know what to do, I do not know how to do it better. A single phone call, he comes quickly, really quick, so it helps. You go for the one who comes down quick and who cares about you and your practice and your work. So that's important. Yeah.
It's funny because it doesn't matter what business you're in.
Yeah.
The people who build relationships always win.
Yeah.
And the people who build houses or teeth or construction, my boys, their mom's brothers had a construction company.
Uh-huh.
And they built one of the biggest construction companies in the world. In construction, key construction in Kansas, there's no new technology.
Okay.
It's just that they're absolutely built relationships. They stand behind all their work. If there was any problems, they came back and they did customer service better than anybody in Kansas, and they built the largest construction company. And so you went with E4D because you have a relationship, because
Yes.
the computer 2 milling components
Yes.
isn't the issue.
Is an issue.
It's probably the block's not the issue. What the issue is the relationship.
That's right.
And then I think what's neat is, since you don't have the drug of new patient advertising, direct mail to get addicted to getting all these tons of new patients, since you don't have that drug, you'll have to focus on keeping customers for life.
That's right.
You'll have to focus on listening to your patients and making each one of them happy.
That's right.
Because you just can't go do another mailing and replace
You can't. It's
and
not
get
a-
100 new patients for all the 100 that left your business because you didn't listen to them.
Yeah.
So I think in the long run, not being able to advertise will probably be much better for you, because you'll have to get all your basics. You'll have to get an A, and it's kind of like a football game. You got to get an A in blocking and tackling and a catch and a pass, and there's no easy fixes.
Yeah.
And without advertising, and you have to pay attention to each customer, each patient, and treat each one like they want to be treated. That'll be what keeps you, building a huge monster.
Yes, you said it. That's right. It's always a challenge. So every customer is important.
Why do you like CAD/CAM though? Why do you like CAD/CAM? What does it offer you that
No, basically it's like what every dentist is. Why every dentist is going to CAD/CAM is a lot more. You have a lot more control, and of course it's supposed to be a lot better than composite. I mean, we have seen the results.
Okay, so you if you make the restoration in the mouth directly, you don't like the direct resin materials. You would rather have it made indirectly out of the mouth,
Yes.
because those materials you like better. You feel they're stronger.
Stronger, that's right.
And what material are you using? Emax? Are you using zirconium blocks? What are you
Usually
using?
we use zirconium.
Zirconium.
So, but zirconium, we are still trying to improve. Yes, aesthetics is still a little bit of a issue. Yeah.
Yeah, and I never really thought it was an issue, because like when I'm sitting here talking to you two, you're not seeing
Seeing
my
out-
back teeth. I'm not
That's right.
seeing your back teeth. And when I was your age, all those fillings were silver metal.
That's right.
So now that it's tooth colored and slightly different, I mean, I just don't see.
You're right. But as dentists, a lot of us have a little bit of OCD. So
a little,
just a little.
How
so,
about a little lot?
Yeah. So when you put it in and you try to, it's about you. I mean, the patient's like, oh, it looks big, it's nice, it's solid, it's strong. But for you, it's like, okay, I think it can be a bit better.
So what other things are popular in Singapore? Is teeth whitening popular?
They were pretty popular, but I think because now with so many other sources, like I said, there's a lot of beauty salons offering teeth whitening. It's not exactly.
But but walking around Singapore for the last 3 or 4 days, Greg, sit up and show me your teeth.
Nice.
I mean, I haven't seen. I mean, your teeth are pretty white, and you've bleached yours a lot. You haven't bleached yours?
No.
Yours aren't that white, but I haven't seen very many bleached teeth in all of Singapore. I mean, I think you have the whitest teeth
here.
next to Greg. Let me see it. Yeah. But I mean, you know what I mean? So,
Yes.
but you're saying it's kind of popular?
It's
or?
kind of popular because they're always attracted by the white smile. They tune into the media. all the celebrities all have white smiles. So it's still probably it's in demand. Just that, how do I put it? They do it, but they don't maintain. That a lot of our patients have done whitening, bleaching, but they don't follow up. They don't do the maintenance.
Is there any other technologies that you like that you use in your offices besides CAD/CAM, E4D from Plan Mecca?
That's about it right now. So,
That's about it. So Megagen implants, E4D, CAD/CAM,
Yep.
and so can you think of one last question? Can you think of any differences in dentistry in Singapore versus, like, say, your neighbor Australia?
Well, they work less hours.
The Australians.
Yeah.
So what are your hours?
Our office is open 6 days a week. 6 days a week. So
And what are your hours from what to what?
we have 9 to 9, 9 a.m. in the morning to 9 p.m. at night. Of
6
course,
days a week.
5 days a week. Then on a Saturday it's 9 to 6. Of course, we have all our doctors rotate. They're on a shift system. So everybody works about 4.5 days.
And what would the hours be in Australia?
I think they only work 3 days.
3 days?
Short days. 3 like 10 to 5.
Yeah.
Yeah, something like
So
that.
what-
That's what
what-
our friends said. Yeah, so.
Yeah. So what do you think that is? Do you think that's just a
Education, and basically the whole profession has to educate and then trying to get more. I mean, it's the whole industry and the ministry as well. We're trying to get people on board, go towards insurance perhaps, so that people pay accordingly. Because right now, a lot of patients in Singapore, they want to do better work, they want to do better restorations, but they can't afford because they pay out of the pocket. So when you have insurance and you can actually pay for better restorations, better prosthesis, I think it's good. At the same time, when you educate and you can do a lot more, it becomes more preventive work. There's less need for a lot of we're always fighting fire. We're trying to do emergencies. The reason why we open such long hours is a lot of patients they don't take leave to visit the dental office. They come after work, and a lot of time you're still doing emergencies like toothache, infection, stuff like that. So I think if greater awareness, greater education, you bring that down, you make people more committed to dental health. They'll take leave. They'll visit dental office regularly. You have less emergencies. You don't need to work such long hours. And with hygienists on board, you have hygienists to do all the preventive work, then a dentist do less restorative work. I think it's a win-win for all. Hopefully.
So what do you think is better for the dental industry in Australia, where there's a lot of dental insurance paying for the dental procedures?
I think
or
so.
Singapore, where there's no dental insurance and it's all out of pocket?
My personal opinion is I think the dental industry in Australia is a lot better. Because
Because of dental insurance?
not so much dental awareness, because of dental insurance, it's everything encompassed together. With dental insurance, people realize the importance of good dental health. They are more committed in their preventive dental care on a daily basis, and they are aware of, okay, you really need to take care of your teeth. If not, there are a lot of repercussions. It's going to be really costly. And if you do that, I think it's a lot better. All my dental peers in Australia, they are saying when they see the dental patients, they come in, it's more for big cases, big work. It's not always dealing with dental infections. Yeah, so I think that's good.
So my last question, sitting between these two handsome bald heads, are you going to go home and shave your head tonight to match the hygienist and dentistry? Don't you think he'd look better with his head shaved?
I think I'll look better, but I think my wife would kill me. So no.
And my last question to you is, I noticed you have decorative gold on your teeth. What are those? Here, come forward. So are those all decorative?
Yes.
And what
I
are
have
those
perfect
called?
Teeth. So sorry.
What are they called?
I guess they're called tooth gems.
Tooth gems.
Yeah.
I think they look nice.
Yeah, I think so too.
Do many people in Singapore or Southeast Asia have those?
I think it was a trend, but nowadays we seldom see it.
It was a hit, same about 7 years ago. It was a hit. So a lot of people are coming in with crystals or even diamonds, real diamonds, and asking us to bond it on. It was a trend, and I'm not sure where it originated from. Maybe it's from Japan or Taiwan. You know, a lot of folks, a lot of young ladies here, and a lot of young men here will pick up on such trends and they'll appear trendy and they'll do all this bonding stuff. So yeah, you just bond it on.
The trend in America that's really hot is to get a big belly. And that's why I'm just doing that as a trend. Okay, well, thank you so much for your time.
It's been my pleasure.
Thank you very much.